Good morning, everyone. Welcome to our second Bridging the Resource Gap that 201 Tampa Bay Cares has been putting on. We have an unprecedented time here in our community with the pandemic. And our first series that we did with the faith community was around evictions. And I do want to point out a little bit about that. I'm going to share my screen really quick. As you can see, behind me is our website. And we posted that eviction webinar because we were not going to do eviction topic today. But if you want it, Gulf Coast Legal Services did a great presentation about that. It is on our YouTube page. And I'm going to share my screen quick and show you where that's at. So if you go to our website, you'll see this is our the YouTube button. If you click on there, you're going to see here's two. We did housing and evictions. We did actually a town hall discussion with Bay Area Apartment Association, the Pinellas Community Foundation, and Bay Area Legal Services, discussing different perspectives of the eviction crisis that was blooming at that time. And then we also had specifically for the faith community Gulf Coast Legal Services. So those are there. I really encourage folks to visit. And again, I will put our website address in the chat button. With that, again, thank you so much for joining us today. Our goal of these is really to help equip those that are in the faith community with resources. On a personal level, my mom was a church secretary for 25 years and then volunteered in the church office. So I grew up in the church office. I know folks come to the church for help all day long, not just all week long, not just on Sunday. And I know sometimes that can be a challenge for folks of going, where do we turn for help? So with that, I'm so pleased to introduce Michael Raposa, a good friend and colleague of mine here in the community with St. Vincent De Paul Cares. He is the CEO. He is a tremendous advocate for housing first in our community and for tremendous advocate for individuals and families who are needing help. He's going to do a presentation, and again, just to let everybody know, we are going to have, please utilize the chat if you have any questions throughout the presentation. With that, Michael, welcome. Thank you so much for joining us today. So I'll turn it on over to you.
Hey, Mickey, and hey, everybody. Happy New Year to you all. As Mickey said, my name is Michael Raposa, and I am the CEO over at St. Vincent De Paul Cares. We're based here in downtown St. Petersburg, but we're providing homeless services now all the way from just south of Ocala to Naples. We've got about 17,000 square miles. And we provide everything from working with the folks out on the street to actually getting them into housing. And we actually have housing where we place some of them in some communities. I have also worked for the Catholic Diocese of St. Petersburg for over 30 years in and out of church offices. So I know that the churches are a magnet for people coming, people trying to get assistance. I also know that the church is one of our greatest resources. And I know from St. Vincent de Paul's perspective, our parish communities are and really more of the Methodist communities than the Catholic communities are really probably highly motivated towards working with the homeless. A lot of people want to do things, but they don't know quite how to do things. So I hope to accomplish two things today with you. And I'll probably talk for maybe 15 or 20 minutes, and I've got a PowerPoint I'm going to pull up for you. I hope to be able to show you what is happening across the United States and in our community at varying levels
Go ahead, Michael. Sorry.
Am I unmuted now? Someone give me a thumbs up if you can hear me. All right. Hi. I don't know what the heck happened there. So I want to accomplish two things with you today. I'm hoping to be able to share with you the systemic approach to ending homelessness. And I've got a map and I've got some stuff I want to show you. And then there's two key components in that where church congregations can fit into this. And there are some serious do's and don'ts. I may say some things that from a Christian community perspective, you may say, oh my God, he's a heretic, because some of our Catholic churches said it. But I think that when I get into the methodology as to why doing some of the things that the natural tendency to do is by not doing them, or actually helping people more than actually doing them. So I am going to share screen. I'm going to share this screen, and then I'm going to pull this up. There. All right. So across the United States, homelessness is affecting nearly every community. And it's affecting communities, not only for those that are out on the street, but the COVID-19 pandemic has brought to the table a crowd of people that have never, ever needed the system before. And not only have they never needed the system before, we're discovering in many instances they were among those in middle class that scoffed at the people that needed the system. And on or about March 17th, 2020, when the world shut down, by April 15th of 2020, when their paychecks stopped coming in, they woke up and they realized that they needed help. And they needed help from a community of service providers. And they found themselves among a group of people that they never expected in their lifetime to do it. I believe that as we enter into the first quarter and second quarter of 2021, we're going to have an unprecedented demand for need in some of these areas. There's two key words that I may use. I want to define them from the beginning. I may make reference to a community of care, and the community of care, or the COC, is a local agency that has been designated by the Department of Housing and Urban Development to lead the system. And here in Pinellas County, and I'm assuming that most of you are here in Pinellas County, that is called the Homeless Leadership Alliance. It's a private nonprofit agency that is designated by HUD to lead the overarching homeless system. I chaired that board of directors for 2 years, and I sat on that board for 6 years, and was really was fairly instrumental in bringing the system into play in Pinellas County about 4 years ago. There are also a series of federal partners. So the federal partners are a group of agencies at the federal level that have teamed together to address this problem nationwide. And that's the Department of Housing and Urban Development, the Veterans Administration, which has got the largest part, second largest part of money, the Department of Labor, and then there's also a group called the United States Interagency Council on Homelessness, or USICH. So and I will tell you that in the last 10 years, this is the first time in the history of the nation that these incredible silos based in Washington, D.C. have actually begun to work together and began to show the impact of what would happen if our federal government departments actually began to work together. And don't laugh. It wasn't meant to be a joke, but it is kind of funny, and I see some of you laughing. So what happened was we worked together, and I worked very closely on a federal level to begin to put this together and test this nationwide. A system that has several core components. The first core component is coordinated entry. And coordinated entry means that what was happening is homelessness is scattered throughout the community, and services will willy-nilly knock at the door, get some help through the church, through an agency, through the government, God knows where, they would just scatter. But one of the things that we realized is that we can coordinate the entry point of the system and bring people to one location, or one theoretic location, even if it isn't the actual physical location, and begin to coordinate and triage homelessness, we stood a better chance of solving the problem. And we have proven this to be true. The second core component is street outreach. And there are core components in our community, both for veterans and non-veterans, that work the street. There's 10, 12, 15, 25 people on a daily basis working the streets of Pinellas County, especially targeting families with children, to try to get them connected to housing and trying to connect them to the homeless system. We've begun to see a transition in street outreach because for the longest time, the street outreach was trying to get people to the homeless shelter. Well, our homeless shelter system is completely full. It's complete. We run a shelter, it's full 24/7. But prior to shelter, and I put these two bullets in red for a reason, because these are the two areas where I feel that church communities can really, really make an impact. The targeted prevention and diversion, I'm going to talk more about in a second. And helping sheltering is not sheltering at your location, but supporting the shelter system is really, really huge. And then the bottom four are housing interventions. So the top four are inflow into the system, in the system, and then the last four are moving people out of the system. Rapid rehousing is an intervention where we believe, and we have proven to be true, that we can move a homeless person from the street to housing in about 30 days and support them in that housing for a period of time until they're sustainable, and then we withdraw our services. Our organization is the largest rapid rehousing provider in all of the southeastern United States. We are the largest rapid rehousing provider for veterans in the entire United States. We have $17 million contract with VA to do this contract. We've got about an additional 6, 7, 10 million in non-veteran money in doing this for families with children and individuals across our region. And then there's transitional housing, which is three-quarter housing or halfway housing for homeless. This is a dinosaur. This transitional housing piece of it is really being eradicated from our vocabulary, except in 4 instances. And there's 4 instances where transitional housing is really, really appropriate. Now, this is a change because the system used to put all homeless in transitional housing. They used to assume all homeless were broken and needed transitional housing. But what we have proven over the last 8 years or so is that homeless people, generally speaking, are ready for housing the minute we see them, even if they're drinking and using drugs. And this phenomenon was proven to be true. And it's the same in my family, and it's probably the same in your family or people you know, because I believe that we all know people that drink too much and we wish that they would stop, but they're housed. We also know people who use recreational drugs and we wish that they would stop, but they're housed. And so to connect housing to stopping a behavior just makes no sense because it just doesn't work. So we house people first, and then we work with them once they're housed to stabilize them, which may or may not include them ever getting sober. And we've proven this to be true at about 87.5% success rate. But the transitional housing is very, very expensive. And the transitional housing is really only designed for those that are experiencing domestic violence, those that are experiencing reentry into the community after having been incarcerated. It's really appropriate for unaccompanied youth who are out on the street between like 18 and 25 years old. In our community, we're actually seeing that number out on the street much lower, down to 15, 16, 17 years old. There are an inordinate amount of LGBTQ people that have been thrown out of their house once they came out of the closet, by fine Christian families, by the way. And if you noted that sarcasm, it's true, that, threw their kids out on the street because they came out because they're gay. And then the final good use of transitional housing is because of people that are either in early recovery or those that are chronic relapsers from addiction and that are actually trying to get sober. They do well in transitional housing. Not everybody needs transitional housing, and I'd like to think of it as a medical need. And the final component of the system are the actual 2 housing interventions. There's permanent housing and there's permanent supportive housing. So this is an example of how all of this works together on a map. And I want to share these slides with you. I didn't get a chance to PDF them and give them to 211, but I'll make sure that you get these from 211 so you can refer to this. But if you look here on the left of my screen, this is the 2 entries into the system. So street outreach works out on the street. They try to get people to coordinated entry, or in some instances, they try to get people directly to shelter. In coordinated entry, if they need shelter, they go to shelter. But if they don't need shelter, they try to go to a resource that has prevention and has diversion. 211 Tampa Bay Cares is actually a great resource in our community. We're really, really lucky to have them. I know that oftentimes people say the call time's too long there, but I got to tell you that means that they're a victim of their success. It's because they're widely known, because people are constantly reaching out to them. And I don't know that we could ever make our 211 call center large enough. I don't think that there is such a thing as a large enough 211 call center to handle the community need and to be able to target that and know what that is. So they reach out, they go to targeted prevention and diversion. From there, if they're able to retain housing or on their own and bypass the system, they go straight over to housing. If they go to the shelter and they're able to exit on their own, and more than 10% of the people that come into shelter will self-resolve. They'll figure it out on themselves. They only need 1 or 2 nights, and they'll go here into permanent housing on their own. If they're unable to find permanent housing, like within 7 days, they get referred over to a rapid rehousing program. And again, they end up in housing. And within specific populations, and I just told you what those 4 categories were, they would go over to a transitional housing and then into permanent housing. And then those that have the highest need, that they're unable to maintain housing on their own without ongoing services, go into permanent supportive housing. So the difference between permanent housing and permanent supportive housing is the word supportive. And this is kind of like a step just before assisted living. So we have people who are out on the street who really do have chronic mental illnesses or physical illnesses, that they're really not going to be able to take their medicine, and they want to take their medicine, but they just can't do it. Or they're not able to really care for themselves, but they're not quite ready for a nursing home or assisted living. There is a whole network, primarily run by Bowley Centers, who does an amazing job here in our community with it, that run permanent supportive housing. So this entire thing, once in place and seen in this way, works to drop the numbers dramatically. We proved this to be true in Pinellas County through our work with veterans. When we began our work with veterans in about 2012, there were 2,850 homeless veterans out on the streets of Pinellas County. Today, there are under 300. And it's because we were able to get all of these core components working together as one unit, that we began to triage them, we began to get them into shelter, get them into rapid rehousing or transitional housing, and then move them into housing. And so now, as a veteran experiences homelessness in our community, they're able to move from here to the right, from left to right, within about 45 days, which is huge. We've also been fairly successful with families with children, and we're just beginning the work in our community with chronic individuals. The goal of the system is to be rare, brief, and one time. And the system can only control 2 of the 3. We can control the brevity and we can control the non-returns to the system. But the goal is that a person seldomly experiences this. When they do experience this, it's for under 30 days. And then once they've been stably housed, they should never return to the system. Close to 90% of the families and the individuals that we've housed with St. Vincent de Paul, using this system as a model and as a benchmark, 90% success rate. So that is huge odds. I'll take those odds. Those odds it is not 100%, but I'm going to tell you nothing is 100% in the world. So what's the solution? The only solution for homelessness is housing. Communities across the country can move people, they can shift them, they can take them, move them away from the beach, move them away from the central area. You're just moving the air within a half blown up balloon by doing this. The only solution is to pop the balloon, let the air out, and move people into housing. Housing is the only solution. And there are a lot of people at this point in time who say, well, there is none. That's a lie. Do not believe them. Anyone who says that there is no housing is using that as an excuse to take no action. And we have access, and there's tons of housing in our community. It's not as easy to find today as it used to be, but it is there. So I want to talk about targeted prevention and diversion. because this is the area where congregations are already doing this stuff when someone knocks at the door and says, I need help with my light bill. If you don't help me with my light bill, I'm going to become homeless. And there are two tasks in this. The first task is targeting, and it's trying to identify the people with the highest risk for becoming homeless. And then it's also the services, and the services are designed to help avoid people from entering into the system. And sometimes bad targeting is oftentimes confused with successful services. So if they're knocking at your door on a monthly basis to get help, the problem is significantly larger than help with the light bill. There's some type of intervention that needs to happen with them to get them to the point that they break this cycle of always needing help with that light bill. Most people are only briefly homeless. The issue becomes identifying those who are likely to have a longer stay or repeated stays. So there are single individuals who are long-term episodic users. Some of them have more mental health and substance abuse issues. And there are also families that we work with that are episodic. They're not long-term, and these users have more involvement with other systems. I will tell you that the church communities are not prepared to handle the long-term episodic users. You might as well take the money or the check or whatever it is you're giving a long-term user of the system and just shred it. Because until we can get an intervention to break the cycle with them, you're not helping them. You're just wasting money. And I know that that might be painful to hear, but it is not untrue. There are many who are heavily involved in this area, but they're not connected to the overall system. And I really urge those of you that want to be involved to get involved with the partners that are in the system that have the full-time social workers and that are doing this job. St. Vincent De Paul Cares is only one of those providers. And I should probably not be as shameless in trying to get you to work with us, but I'm not going to do that because I think that there are a lot of other good providers that need your help as well. And when we talk about the difference between prevention, there is a difference between prevention and diversion. And in prevention, the person seeking the help, I'll call them an inquirer, they have a place to stay, but the place is unstable, but they can safely sleep there tonight. So this is primarily people from your community that have fallen on hard times. They have housing, but they just need assistance to stay in that housing. Now, there are strengths and there are weaknesses, there are pluses and minuses to this, and our staff is trained to figure out whether it's a good investment or a bad investment. Because sometimes this prevention money is a waste because the housing placement that they're in long-term is non-sustainable. So what we've discovered, for example, is we've discovered people that are making $3,000 a month, but their rent is $1,500 a month, which is 50% of their income. That's too much. And they've got car debt and 4 or 5 kids and all this other stuff. They can't sustain that. And so that sustainability in prevention is a factor that's a whole separate conversation that we don't have time for today. But it's important to take a look at. And then there's also the diversion issue. If they come to you and say that they don't have any place to stay and shelter is imminent, giving them money at that point in time to anything outside of getting them to a shelter is a waste of money. It's an absolute waste of money. We need to connect those that need the shelter to the shelter to get them into the system, to get them out of the system. The resources that we use are similar in both. They're going to ask you for rent, they're going to ask you for utility assistance, and they might ask you for food support. However, when we get into diversion, the mediation skills are required. And again, I don't know, unless you have a full-time social work person working in your parish office, I don't believe that churches have the ability to do true diversion. I will tell you that one area of diversion where church help is dramatically needed is that we come across a lot of people who have come to Florida, especially this time of year, from places up north, thinking that we had all of the jobs openings in the nation. We're all here. And they get here and they discover that we have no jobs, just like anywhere else. Sometimes we need that bus ticket or that plane ticket to get them home. And in getting them home, it actually helps the system because it returns them back to their family and their friends, and it gets them out of the way. And then we're able to have a conversation that says, please don't come back. So what can your congregation do? I believe that there's about 4 things that are really, really critical to consider. I think number one, I think connecting to a current the prevention and diversion type services with local agencies is critical. We need money that we can access that doesn't have some of the federal restrictions to it. Sometimes it's not a lot. The other thing that I'm very, very concerned about, and the system has not been able to address this, is for a person in our community with a $250 light bill that is past due, and many of these are grandparents that are raising their grandchildren, they have to go to 5 separate locations to get assistance with that light bill, because most locations are only willing to do $50 at a time. And wouldn't it be amazing if we had a clearinghouse of all of the prevention and diversion services, that they could go to one location with access to one pot of money or access to all of the pots of money at one location, that one group could process the $250 light bill, but we could access it through varying pots and get reimbursed through varying pots. This is a level of system-wide coordination that is kind of the utopia of what the perfect system would look like. What we have proven is that silos don't work. And the more that we can connect both the private and the public together to remove those silos, the more highly effective we are going to be ending this in our community. The second thing is that people have to stop paying for emergency shelter, such as hotels, without services. It only makes the problem worse. Now, this is the line that had a whole group of Catholics, by the way, I'm Catholic and I work for a Catholic organization, that said, you're a heretic for saying this. Jesus came into the world homeless. We have to solve this. And I'm not discounting that, especially this time of the year. But I have to tell you that if we don't break the cycle of getting the people out of hotels, they're going to live the rest of their life in hotels. And hotels are actually a form of like that rent to own. I mean, they get caught in a loop that they're never going to get out of it, because they're spending all of the cash and the resources that they have to stay there, paying by the week, that they're never going to be able to save the money for the down payment or the deposit into a unit. We have to stop doing this. So if we can connect them to the services that are providing the hotel motel, I think that that's good. And we're doing that. So Vincent De Paul Cares is doing that. And we could use help paying for more shelter beds. The difference is that we have the social workers, that they don't get to stay in that hotel without working with the social worker. So they get the hotel stay, they get off the street, but we begin the housing intervention at the hotel and it's working. The next area where we really need congregation help is supporting housing placements. So we're moving, we moved 541 homeless people from the street into housing since the pandemic started. I will propose that this is probably the largest number across the United States, because the federal partners have told me so. Our staff have moved 541 individuals and families with children in the Tampa Bay area from the street into housing since the pandemic. This is while every other social services organization has been working at home, playing solitaire on their computers. We've been at work and our staff has done this. The challenge is we don't have the money to support them with food. We don't have the money to support them with furniture. And sometimes we don't have the money to support them with the emotional and the spiritual support that they may need. This would be amazing that if your church community covered, let's just say, a neighborhood in Clearwater with specific boundaries, and we housed someone in your area, that if they were willing to have someone from the church come visit with them, and maybe it's an opportunity for evangelization for you. I think that that's another opportunity that's there too, because these people do need a level of spiritual support that we don't do because we're federally and state and local government funding, that even though we're Catholic, we only do that should they ask. That this might be a great opportunity for the church to do evangelization and support people that are coming out of homelessness, to give them a new spiritual home. Now, that may have seemed like that was Catholic guilt woven in that, but it was only a little bit. And then finally, and this is a little bit of a selfish plug, we who are running the local shelters are in desperate need of essential items. We need shower items, hygiene items. We need donated men's clothing in good condition. 75% of the people that are in homeless shelters in our community are men, almost 80% on any given night. Men never throw their clothes away. So if get with the wives or the mothers in your community to raid their husbands' closets and start throwing stuff out. Put it in a bag and get it to us. And hopefully it's clean. And we desperately need men's clothes and anything that a man needs to do to shave and shower every morning. We are one of the only facilities in St. Petersburg where the homeless off the street can take a shower on a daily basis. And we need everything from soaps and that type of stuff. And we're not the only shelter that needs that, but our need is dramatic. So I'm open to questions. I can unshare the screen in a second. This is who I am, and I know that I see my staff sitting there cheering me on in the peanut gallery to the right. But I have a person on our staff. Her name is Annie Early Smith, and she's waving. Hi, Annie. She's absolutely amazing at coordinating with communities and with the community and with parish congregations that are willing to help that support. And this is her information. Her phone number is 727-542-4887. And her email address is Annie, ANNIE, @svdp.care. And if you reach out to me and it's something wanting to connect with us or have a deeper conversation about supporting with us, I'm probably going to send you to her anyway. And I will make these slides available in a minute. Done.
Thank you. Thank you so much, Michael, for that fantastic overview. I think it's really helpful for folks to know about the whole system of care and how to plug in maybe in new ways that we haven't done before. I know we do have some, there was a chat question that came up while you were speaking. Terry, can you read that for me?
Yes. There's a question, is there sufficient housing for individual adults?
So every community thinks that all of the housing is everywhere else. So I will tell you that we currently have over a caseload of over 600 rapid rehousing cases open in Pinellas, and none of them are being held in homelessness because of lack of housing. The affordability is a challenge. So so there is sometimes a gap with that. What we're seeing though is that landlords, especially private landlords, and this is probably an area that I should have put a bullet in there, that if your church communities have units, and let's say they have 5 units or 4 units, we work with them to try to see if they'll make one of those 4 units affordable. Because most landlords are in it for the business and they're in it for the income. So to ask someone with 4 to make all 4 available is just not realistic. However, asking them to consider to make one affordable for a period of time is realistic. And most of these landlords are willing to work with this population as long as we as the provider stay engaged with them. So it is probably the only healthy triangular relationship that there is, because there's the relationship between us and the client, between the client and the landlord, and then between us and the landlord. And we work together with them to make sure that it stays sustainable. And when we say sustainable, we actually work with the client to try to get them access to a Section 8 voucher or a HUD-VASH voucher, or try to get them a subsidy if they're not able to do it. We have access to employment services and employment strengthening services and things along those lines. And so it's good. I will tell, sometimes people will say, well, how long do you provide the subsidy to keep them in that housing? The longest we've ever had to do is 9 months. And I know that might seem like a long time, but we do have the resources to do it. But once we do pull the plug after 9 months, they almost never come back into the system. So it's a little bit of intensive care on the front end of it. And that 9 months might be $9,000, $10,000, depending on what the rent was. But for that investment, it pulls them from the system forever. And I think it's a good investment.
Definitely. We've got a couple other questions, Michael. There's one that would like to know if there is a resource or somewhere that we could go to where do we find the service providers that are available to help the faith community? Who can they refer to?
Well, of course, us. um, and there are quite a few. I don't have a list of providers that are doing this. 211 Tampa Bay Cares has a list of service providers that maybe they can just attach on their website to do it. The one thing that I would really take a look at is when you're speaking to these folks, ask them how many people they moved into housing, because there's a real difference about helping people experience in homelessness and then helping people end homelessness. And a lot of our service providers do a great job of helping people in homelessness. But you want to know, how many are they getting out? How many have they stably housed in the last 12 months? And what's the success rate of doing that? Now, they're not going to like you asking that question because we're the best at doing it, and they're not going to want you to know that.
Great, thank you.
So, and we will definitely include a list of those shelter providers. We'll also include it at the bottom when we post the video on YouTube. We'll also include that list in there. But to Michael's point, I think it's also helpful, no matter what nonprofit organization that you choose to get involved with, learn a little bit more about that organization. You may want to look them up on some of the nonprofit lists. There's guidestar.org, there's Charity Navigator. You can look up how that organizations are utilizing the funding that they receive and the success in their mission. So I would definitely check out those as well. We can use those in the we'll send those out in the letter, those links, as well as, and we'll put it in below the video. I think there's another question.
Yeah, there's
Here.
another question. So, Michael, if someone comes to our church in transition, how do we get them connected to you, and what is the wait time?
So that I need to know more about the individual case, because the wait time piece of it depends on where they are in what they're doing. I will tell you that if they were connected to a worker in our end, we reach out same day. And sometimes, well, if it's 4 o'clock in the afternoon, that just might not work. But generally speaking, this time or by the next business day. If they are in a vulnerable state, so if they are a family with children, or they're vulnerable because of age or physical capacity, and I'm always cautious about talking about the age thing, but if they're elderly, we will respond instantly. Or if they're traveling with a family with children, we will help instantly. We can almost always get them into a shelter placement or temporary placement for that night, same day, with no problem. Pinellas County also has a very large contract in place for street outreach. They're supposed to be responding same day too. We're the largest of the outbound services from the system. And we've got a little bit of shelter in the middle of the system, but we're really the outflow. So we've got the bulk of the rapid rehousing and the system outflow money here in Pinellas County. We've got about 600 open cases today, which is huge.
Wow. Very good. So is St. Vincent de Paul the lead agency for homelessness? They're trying to determine, is there a best single point of contact?
So the best single point of contact would be the Homeless Leadership Alliance. It's called the HLA. And please don't ask me their phone number. Maybe if Mickey could put this on her list of things that she will give you, because I don't know that by heart.
We will do that.
Yeah, they have outreach workers there as well. But the Homeless Leadership Alliance is the designated alliance that a group in our community that has been designated as being paid by HUD to oversee this system and to make this system work. That's Homeless Leadership Alliance.
Great. Do we have any other questions?
I think that's it for the questions. Does anyone have any they would like to any other questions they'd like to note?
While we're waiting for folks to add that, I think just to also add, and maybe Michael can have some commentary or maybe some thoughts on it as well, but I think keep in mind that our continuum of care, the system that Michael shared, is set, but those connections between those continue to evolve to improve the system. I do know there are some, hopefully, there aren't final plans yet, but I think there's going to be some more engagement. I know Michael did a press release with big news of funding available for families with minor children in our community that may be partnering with the schools in the future. But again, some of those may not be happening right this moment, but keep in mind, it's not going to stay static. There's going to be, as new resources maybe come in, the system's going to continue to be to evolve. Michael, do you want to share anything about that?
So if you saw the news right before Christmas, our organization was one of 7 organizations that was awarded a gift from Jeff Bezos from Amazon. We received a $5 million gift from Jeff Bezos personally, not Amazon itself, but from his personal wealth to work in conjunction with the Pinellas and Hillsborough County school system to end homelessness for children in the school system. And this is huge because most of those kids that are in that school system never fall into the shelter system. And most of the current resources we have target the shelter system. So we're just evolving and just about to put that system in place. The school is a big silo. They're the biggest of the silos, and it's a challenge to get data and get them connectivity. It's amazing how well doors open when you have a $5 million suitcase in tow. And so we've been able to kind of open doors and get collaboration and achieve collaboration. It's very exciting for us on both sides of the bay. I would propose to you that the system evolution that Mickey made reference to for families with children is well on the way. I mean, we had weeks in 2020 where there were no families with children on the waiting list that we were able to take them same day. Now that ebbs and flows, and that changes absolutely every day. Now, the issue with homeless individual male, individual female with none in children, which is the largest of the population, that system is still a little bit of a challenge because of the volume and because of the coordination among the providers has not developed as quickly as it has for the other cohorts.
So Michael, another question for you about if a family pulls in the parking lot in their car with minor children with them. I know I've had a couple of churches talk to me about allowing cars to stay in their parking lots. That's been something that I know I have heard. I didn't know what your thoughts on that were, and what would be the best avenue to connect those people with that get connected to services. You could certainly call 211. We're going to share the local shelter information, but as we talked about, sometimes they're full. Most time, particularly families with minor children, we don't have a lot of space for that. So what are your thoughts on that? I know it's a hard question.
Well, I wish I had a phone number. I wish I had a 711's probably taken. I wish I had a 111 phone number that would get you directly to us, because we're currently working behind the scenes. The Juvenile Welfare Board has just reallocated several of their fairly substantial contracts. They've reallocated those contracts to us. And we're going to put together a system in place where I'm going to, in the coming weeks, going to be able to tell you, call this number and we will get them. Same day, we will get them into a hotel motel same day, and we will get service providers to them within the next morning to get there. So we're not there now, but I bet you by February 1st we are. That money is, what happened is the system concept and the evolution of the system. A lot of people had a lot of money and a lot of buckets that were doing the old way of doing things, and they were not getting the results that they wanted. And the good news is that most of our local funders have woken up and realized that we need an emergency response system, especially for the most vulnerable populations like the families with children and the others. If you want to email me after hours, that Michael at SVDP Care, and put a lot of information in that email and say, hi, this is Joan and I'm at blah, 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 blah church. this has just happened, I will click on forward to that email, even if it's after hours, and get it to my staff. And try to see what we can do to get someone out there. The safe haven piece of it, please allow that, especially if it is safe and they've got children. But I'm going to tell you, it's probably almost going to be unnecessary. Walmart is a secret safe haven for homeless families. The Walmart parking lots, people can say what they want about that store, but as they have a policy within that store that they will allow families with children to sleep on the perimeter safely in that store, and their security guards protect those families overnight. The good news is that that used to be common, and it's not common anymore because we're able to get them moved into housing, moved into a hotel immediately. Especially if they're families with children. I die at night. Sometimes I lie awake at night thinking if there's a child on the street tonight, it's killing me to see. I don't sleep at night knowing that.
Thanks for sharing those ideas. I know they're real kind of concrete steps while our system's evolving, and we'll make sure we get that number also out to folks when hopefully in the next month. We'll be able to, you'll have that, Michael, we'll be able to direct people to have them contact you directly.
So the other thing, Mickey, I'd like to add to that too,
Sure.
and those that are on the call, the first conversation that you must have with them is try to get them to explore places that they could go on their own. Most people are going to say, I don't have anyone. And one of the questions that we love to ask is, okay, so you don't have anybody, but let me ask you a question. If among all of your family and among all of your friends, if they became homeless and you had housing, who would you put up? And at that point in time, they're able to say, well, I would put up this one. I would allow this one to stay with me and this one to stay with me. Well, you just backdoored your way into the list of people that they should reach out and they should contact. And they may say, but I'm afraid to make the call. And if you're willing to sit and say, hey, what if I sit with you and I make that call to your Aunt Louise to say, hey, can I stay there with my 2 kids for tonight? And then still make the connection for services in the morning, you've solved 2 things. The default answer that they're going to have is, I have no one. And it's almost always untrue, unless they're here from Alaska. They just pulled in and they literally have no one. In most instances, there is someone, they just need help exploring it. And they're probably too ashamed to make that call. And so helping them make that call in a non-threatening way will oftentimes self-resolve it right from the get-go. It's very rare that a grandmother will say, no, leave my grandchildren out on the street. In most instances, grandma doesn't know that the family's out on the street. That's true. I mean, that's almost 100% true on our end. We try to connect with grandma, aunt, uncle, someone in the family, and talk about the children that are out on the street and get them to separate the behavior of the adult, which is probably really bad. But try to get them to separate the behavior of the adult and at least take the kids off the street for the night.
Great. Other questions from folks? Well, while we're waiting, and we have about 8 minutes left, Michael, I just want to say thank you so much for you and your entire team for your leadership in our community. I will say, I know from the in my faith community as well, it has been, gosh, is there ever going to be a solution to homelessness? Is anything ever going to change? And I will say, in my time of, I won't say how long, but a couple of decades in this arena, that there has been a huge evolution from where it was till now. I know it seems like it takes, at a snail's pace, but I do believe, from my perspective, there's, certainly leaders like the St. Vincent De Paul Cares organization, a huge asset in our community, and the Homeless Leadership Alliance, that things are moving along in our community. And I'm really excited about those opportunities, that are going to open up for families here in our community.
Well,
go ahead, Michael.
But Mickey, we have to bear in mind the fact that the homelessness, which is what we're talking about today, is a symptom of the bigger disease. It's not the disease. The disease is the generational poverty that our community is experiencing. And what I mean by that is that generational poverty is different than situational poverty. COVID has brought about a whole bunch of situational poverty. A situation happened and people are now in trouble because of that. Generational poverty means that the person that is in front of you is experiencing poverty, their parents experience in poverty, and their grandparents probably experience poverty. It's the third generation of poverty. And poverty is the answer and is the real problem. And until we as a community, and I know that I get all fired up about this because, we can't stay downstream as a victim of what's hitting us downstream and not recognize the fact that we as a community, we need to really take a look at, the minimum wage initiative is really huge to get an affordable wage into people's hands. We need to work with these people to try to get them sustainable employment, sustainable benefits. And we need to have a serious conversation about educating people on how to live within their means. And that's just a huge issue. And homelessness is only one of those symptoms. The issues that we're seeing with gun control and gun violence on our streets, that is poverty. The unemployment rate, all of this is connected back to poverty. And we just seem to be shy about looking that in the face. And we've politicized it. We have said, well, if we're going to provide help in taking money from the rich and helping the poor, it's socialism. Well, I know that most of you are church communities, is Christianity socialism? And in a certain way, what would Jesus do? I mean, he didn't say, go figure it out on your own. He said, come follow me. And I think that we as a community really need to take a look at in the mirror, and we have to stop being afraid of looking poverty in the face. We have to be willing to embrace it. And we have to be willing to help embrace those people that are in it and help them move to a new way. If they're willing to move, and not all of them are. And I think that that's the bigger issue, that we just seem to back away from it. We just seem to back away from it, and it's sad.
Again, so I know there was a question about sending Michael and Annie's information. We'll definitely send that out. Terry's put in the chat that she'll send those out in our follow-up email to everybody who was able to join us today. Again, I want to thank you so much for taking time out of your very busy schedules to get connected and to engage in our services. We need everybody to be helping folks in our community, families and individuals. So I thank you so much on behalf of our board of directors and our team. And again, we are so fortunate to have such great assets like St. Vincent De Paul Cares in our community. And so I really encourage folks to get connected with St. Vincent De Paul Cares and stay tuned and help in those other ways that you can as well. When somebody brings up, we want to hold a donation drive at our church. Definitely, as Michael pointed out, they need those items as well. So if you can advocate for that, that would be awesome as well. So thank you so much. Again, this is being recorded. We will post the video on our 201 YouTube page, and we'll also share it on social media. So with that, we'll hang out for a bit in case anybody has any lingering questions. We'll hang out, but with that, I thank you so much for joining us. Thanks, everyone.
Happy New Year.
Happy New Year. So there was just a quick question. Are we is 201 going to be doing other webinars?
Just typing.
Yeah. So yes, we are going to be continuing our webinar series, Bridging the Resource Gap. We have mental health as one of those topics, as well as financial assistance. A lot of people have a lot of questions about that system as well. So hopefully we'll definitely make sure everybody who's on here gets information on when that next session should be. I think, Terry, when is that scheduled?
Yeah, the financial assistance is coming in February, very soon. So that'll be just a few weeks away. And the mental health will follow shortly after, probably in March.
So we'll be sending emails out for folks, sending that email out to everyone in there in our follow-up. No, we'll send out I'm sorry. It's been an interesting morning. Definitely in the flyer that we send out, we'll make sure that everyone who's on here with your emails, we'll make sure you get it for the next one. Anything else? Any other questions?
Yeah, I should put my email in the chat. Feel free to email me if you have any other questions.
Yes, so Terry's email is Terry, TERRIC
See?
at 211tampabay.org.
There we go.
All
So
right.
feel free to email me if you have any questions that come up after the fact.
All right, it looks like Michael has stepped off as well. So I hope you all have a wonderful day and thank you so much for joining us. Take care, everyone.
Yeah. Bye-bye.
Bye-bye.